Good day, dearest great surgeon. A very common question has been revolving around our groups about how many questions I should be doing per day to pass MRCS. And many have said to me I can barely pass about 50 questions per day. So let's have a framework for the MRCS regarding how many questions should be done per day to pass MRCS. To pass MRCS, you have at least 3 months, so we are talking about 3 months. In the first week, it's accepted when you are just a starter to have only 50 questions per day to study. You can barely pass the 50 questions if you can do it per day. But after 2 weeks from the first 3 months, you will be increasing. If you have reached 100 questions per day, you are a hero. If you can't reach the 100 questions per day, work on it, work for it. But now we are 40 days away from the exam. Why I can't pass except for 50 questions per day? Because you are not discussing or not interactive with your friends. Yes, we said you can pass with just studying with yourself with the right materials and with the right schedule, but discussion is more important. You are a surgeon. There is no surgery without assistants. Assistant is nothing to be ashamed of. In the operating room, we are all team. The main surgeon, the second surgeon, the assistant surgeon, and the third surgeon, and the observer, and the nurse, and the circulating nurse, and the anesthesiologist. All these teams have to be mutual interaction between all team. Just like the operating room, your study room. You have to be studying with yourself all along. You have to be studying with your friends. Do you know? The basic science, for example, are the longest chapters. Like the anatomy will be 600 questions, so we are in our schedule made those 600 questions divided along a week. And this is too long, by the way, but we divided it into a week, and the pathology and physiology into another week. So the first 2 weeks for the basic science, but they deserve it because they are the main bulk. But the other specialities, you will be wondered to see that the specialities, the longest chapters are trauma, orthopedics, and colorectal. The longest chapters are around 90 questions per day. So you will finish them because they are overlapping with other questions, with other chapters like the anatomy and physiology and pathology. They are not alone, and you will be outstanding and astonished when you see a question is almost repeated with the same idea in other chapter because they are overlapping. So focus on the idea, you can do it. So don't worry if you are getting around 60 or 70 questions per day. You can double this question number by studying with your friends. And while you are having your favorite drink, scroll with your mobile. Scroll with your mobile reading the Telegram discussions or listen the voice notes. By this only, with scrolling only, you are reading at least 50 questions per day. And by the way, if you are studying only 50 questions per day, if you shared 30 questions which are tricky for you, you have been tricking your friends and asking them and taunting them to share their tricky questions. If anyone share his question, if 50 people shared only one question per day, you are reading 50 tricky questions per day. Statistically, you will be reading at least 150 questions per day. Please, this exam trick is to pass with a quantity per day. Not the quality only matters, but the quantity, because in the exam day, you have 300 questions in 5 hours. So take care. How come? You don't have to make the first 300 questions in a row in your exam day. That's why we are having a grand mocks. The grand mocks are long, about 180 questions. And we have been managing that the grand mocks are increasing in time and increasing in the size and the number of the question. So take care. Take them and never delay any mock exam. Taking the mock is not an excuse to not study this day. You have a revision topic. Use this revision topic to study and revise as much as possible. Read the ideas. Scroll with your eyes. Don't read them thoroughly. Just scroll them as you are reading a newspaper or scrolling through your Facebook. That's why we are interacting through the Facebook, and that's why we are interacting through our Telegram group to be familiar with the scrolling. Just scroll. You have your study routine and discussion and scroll. This will make you, if you are studying alone 50 questions per day, you will be studying with the scrolling and the discussion around 150 per day minimum. So if you take another mock, you will be adding them to reach a 200, and you will be wondered if you took this advice that 2 weeks away from the exam, you will be having at least 400 by yourself, other than what you are reading through the exam, through our study groups. You can do it. Together we can. Never study alone. Together we can, with the grace of God. So happy to be with you. Never be afraid. You can do it. This is a sense of responsibility. If you have feeling of insecureness, again, you can do it. You are a surgeon. You will build to be a strong man and woman. Happy International Women's Day. It was yesterday. We are very proud to have an elite surgeons or surgeons, if it can be said, for the female surgeons we have in our group. And so happy you can do it. Join the groups we have, join the discussions, and initiate one. You were built to be an initiator. Spread the word. Together we can.